I think the best thing that you can do as a cancer patient is to find a doctor who you really can trust to provide the judgment you need, and also to seek out some of that information yourself online to enable yourself to be part of the decision-making process. An empowered patient is one who feels that they have some control over the course of their treatment. You do want to give patients some guidance about what you feel is the best approach, but I tell patients that they have a right to hear all of the options. My job is really to present the options and the balance, as best I see it, of the anticipated benefits and the anticipated risks of each of these approaches. That in fact, very often we don't have a clear best answer to how, especially something as complex as cancer, needs to be treated. Nobody is going to be more motivated than the patient and the caregiver. They only have one patient to worry about. Even the most motivated doctor is still treating 10 or 20 or more patients per day and cannot devote that level of attention to focusing on the newest developments for just one patient. But if you can leverage that motivation of the patient and the caregiver, who are going to rally and can dedicate a lot of time and effort to learning as much as they can, and give them the tools to find great information, and then have the patient, caregiver, and the doctor all share it together and discuss what does it mean and what are the opportunities from here, it becomes more of a team approach, because no one person now can know everything that there is to know. It is extremely appropriate for people, even if they have a lung cancer expert or whatever kind of expert in their field, to seek out other opinions before committing to anything. These are big, important decisions that often don't have one best answer. And the fact is, if you seek out a second opinion, you can feel twice as good about it if both opinions are resonant with each other, or you can be offered a new treatment option that might not have been considered before. And you might be ideally very equipped to weigh the options side by side as you make a decision. It's important to recognize that second opinions are absolutely part of medicine, and probably even more so in cancer. Everybody who gives second opinions also has their own patients get second opinions very often. It is not a hurtful process. It's not an issue of ego or shame or rejection. It's just a recognition that this is a very important time. Very important decisions need to be made. There are very complex issues that can't be known completely by any one person, and there's no one right answer to most of these issues. Lung Cancer Awareness Month is a time for us to really use as a milestone and reflect on how far we've come over the last 5 to 10 years. In that time, lung cancer has gone from being viewed somewhat fatalistically, a time maybe 10 or 12 years ago when lung cancer was seen as not much to be done, to now a much more complex setting. Many different kinds of diseases all fit under now the heading of lung cancer. We now are way more optimistic about the possibilities, and we can see that there are a lot of new treatments that are being honed for just one population or another within that broad category.